Hey everyone, welcome to the Health Babes podcast. I'm your host, Dr. Becky Campbell with Dr. Krystal Hohn. And today we have Dr. Emily Kostelnik. She is a clinical psychologist that really specializes in vestibular disorders. So if you're not sure what that is, think dizziness. If you've had any kind of dizziness, whether it's something you've been dealing with for a long time or something that you've had more recently, you're going to want to listen to this. And, we talk a lot about migraines and vestibular migraines, and it just was a really interesting episode. So we hope you love it. Hey, everybody, let's welcome Dr. Emily Kostelnik to the show. Emily, how are you today? We were just talking about a little situation going on in your house.
I'm doing okay. I'm so excited to be here, talk all things chronic dizziness, functional medicine, because it's been kind of my personal story, my professional story. And I'm just so excited to be here and share with everyone and kind of create awareness around vestibular issues.
Yeah, I'm excited to have you too, because not a lot of people talk about this. Even in the functional medicine world, it's not like there aren't many vestibular, I've never even heard of a vestibular psychologist, before I started following you. But it's really interesting. And it's something that we see a lot in practice. And it really needs a lot more awareness and understanding brought to it. So that's why I asked you to come on, because I'm like, people need to hear her. People need to know what this is, because so many people struggle with dizziness, right?
So many people. And it's really a huge gap. You said you've never heard of a vestibular psychologist, and that's because there really aren't any.
Yeah.
To my knowledge, I'm one of two psychologists in the country who exclusively works with this population.
Wow.
And so there's a huge amount of education needs to kind of roll out because, as you mentioned, a lot of people contend with these issues.
Yeah. So why don't you start by telling us, your story? How did you even get into this?
Sure. So you mentioned I'm a clinical psychologist, and I specialize in health psychology, which is kind of like a subspecialty of clinical psych, and then subspecialize even more in vestibular disorders, and we'll talk
Okay.
more about that. And I'm also someone who lives with multiple vestibular diagnoses. So just sort of broad clinical health psychology is a specialty of clinical psych that focuses on the interplay between medical illness and mental health. And it can include things like addressing mental health concerns that come with chronic illness, like anxiety and depression are very common.
Yeah.
But it's really bigger picture than that. It's about health behavior change. It's how to optimize our behavior to address health concerns. So some common areas that like a clinical health psychologist might work with are optimizing behaviors to maintain blood sugar, like with diabetes, how to stay on a dietary regimen, things like weight loss, chronic pain is a big one, smoking cessation. And then for me personally, I specialize in vestibular disorders. So it's kind of a little background of like what a health psychologist does. And then in terms of my personal story, I graduated from graduate school. I was on my postdoctoral fellowship, and I was diagnosed with a very rare vestibular disorder called superior canal dehiscence syndrome, or SCDS. And I just want to acknowledge I know we've used the word vestibular. A lot of people don't know what that means.
Yeah.
A lot of people don't know what that means until something goes wrong in that system, and then they learn the hard way, right? But just vestibular in general is balance, kind of knowing where your body is in space.
Mm-hmm.
But so superior canal dehiscence is a tiny hole in the temporal bone, kind of like your brain sits on the temporal bone above your inner ears, and it causes a whole host of auditory and vestibular symptoms. And I've undergone two very invasive surgeries to repair it. One was a craniotomy, which
Wow.
was unsuccessful. So they had to go back in, try to replug this hole, and then throw having a baby into the mix postpartum. I developed other issues to include vestibular migraine. So a lot of vestibular diagnoses are comorbid with one another. So many people have more than one vestibular diagnosis. And anyway, so that's sort of like my story in a nutshell. And I'm so excited to talk to you today because functional medicine has become a huge part of my own personal treatment, in kind of conceptualizing my issues. And I know this will speak to you, conceptualizing my issues from more of like a histamine mast cell perspective has been a total game changer, just in the way that I think about things, the way I think about flares, but then also opening up so many more treatment options than I even knew there were, because I got to a place where I was chronically dizzy and like really debilitated. And it was like, here are your options. Try this next medication, next medication, next medication. And I was like, there's got to be a better way.
Yeah.
And
antihistamines are a big thing given for that, for sure.
Right. So we know that histamine is implicated in the vestibular system, especially with migraine, too. So I started to sort of like dig into functional world or integrative and learning all these things about toxic load and environmental toxins, mold toxicity, dietary stuff, and like how all these things can make a really big impact. So so that's sort of, again, my story in a nutshell, but I'm so excited to talk to you and learn more kind of about your experience with this stuff as well, because I'm sure you've seen this in your practice.
Oh, a lot. Yeah. So let's kind of back up a little bit. Let's first, for people listening and they're like, what are they even talking about? You know what I mean? What would someone be feeling if they should listen to this? You know, what may be a symptom? Like, what are some symptoms of vestibular disorders? So we know it's about dizziness, but can you kind of go in a little bit more into that? So someone a lot of people know that they have symptoms, but they don't know what they are, or they don't know what they relate to. So they may not even know that this episode is for them. So what should they be listening for that they may be experiencing?
So I think we can talk about symptoms. We can talk about the vestibular system too, in terms of education and what it is. But in terms of symptoms, so I find people can either have sort of like an acute event or more chronic symptoms. So an acute event could be like you have a viral infection and it attacks your vestibular nerve, or you have a BPPV episode, benign paroxysmal positional vertigo, where like the crystals in your ears get loose and they're kind of moving around. You can have intense, like it could be room spinning. You could feel like you're personally moving. You can even have vertigo sensations in different areas of your body. Like your feet might feel like they're moving when they're not. You might feel lightheaded. You might feel like you're like walking in a bounce house. You might not feel like you know where you are in space. So like dissociation is really common, kind of feeling like out of body or feeling like the environment is not real. Brain fog, hugely important, because the vestibular system is really diffusely located in the brain, and it takes up so much cognitive energy. And so when you're trying to utilize that energy to keep yourself balanced all the time, it negatively impacts like executive functioning. So people have trouble planning and organizing and kind of like the higher order functioning, word finding difficulties, that kind of thing. Difficulty walking, difficulty holding your head up, having no energy. And then on top of that, because it's so taxing, the estimate is about like 45 to 60% of people with vestibular disorders will also experience anxiety and depression. And so it kind of becomes like this perfect storm, and it makes it really, really debilitating.
Yeah, because those symptoms make you very anxious. I mean, if you're feeling unstable and you're feeling, I used to get really bad vestibular migraines, and I would feel like my head was being pulled to the ground. So I was very anxious, and I was also anxious to be around other people and have that happen, because I didn't know what my body was going to do. So I can really see why that goes together. And that's why what you do is so important, because there really is an emotional aspect that goes along with feeling this way and experiencing these types of symptoms.
Yeah. Sure. And it's a huge piece of the puzzle. And there's the stigma around mental health, and the anxiety and depression piece can be kind of like a hard one to swallow. But the bottom line of it is, when you have this vertigo or dizziness that's coming out of the blue, it's really scary, and you feel unsafe in your body. People kind of develop this profound mistrust of their bodies.
Yeah.
And our brains sort of rewire it in a negative neuroplasticity way, that people kind of like the term neuroplasticity is used and people kind of think of it only in a positive way, but it can rewire negatively too.
Mm-hmm.
And so what ends up happening is dizziness equals anxiety and anxiety equals dizziness. And so anytime you have either of those things, it becomes the dizziness anxiety. And we call that the dizzy anxious dizzy cycle. And it's really hard to break because it's like, well, am I anxious or is this actually a vestibular event? And it kind of spools up in that way.
Yes.
So that's something I work a lot with people on, calming the sympathetic nervous system. And I know that's kind of transdiagnostic in terms of other people that you work with too. That's a really big piece of the puzzle. But for vestibular disorders in particular, so many people are in this state of sympathetic hyperarousal, constantly perceiving danger, because again, it's scary when you feel like you can't walk straight or you feel like you're being pulled in one direction or another. And so it's about, and I think we'll kind of get into interventions probably later, but creating a sense of calm and creating a sense of steadiness and trust in your body again is a huge piece of recovery.
Yeah, that makes so much sense because like you said, that the fear of it happening even can bring it on, you know?
Mm-hmm.
So let's kind of talk about what the vestibular system is. I mean, so what is happening with your body when you're getting these symptoms due to a vestibular issue?
Sure. So the vestibular system, again, it's in charge of balance and kind of like telling your brain where you are in space. And it allows us to walk around and like adapt to our environments really quickly. So it's comprised of three elements. So it's the inner ear itself. So we have two sides of those, vision and then proprioception, or kind of touch, or the way that, like, if I'm standing up, the way my feet feel on the ground, or sitting in this chair, like the way my back feels against the chair. And it's this kind of delicate balance between those things, providing input into our brains to tell us where we are and how to move appropriately. But then when things go wrong for various reasons, and we can talk about like some of the different vestibular disorders, that can basically become out of balance. So would it be helpful to talk about like some of the different vestibular disorders?
Yeah,
Okay.
very.
So just kind of an umbrella, the lifetime prevalence of any type of like vestibular vertigo is thought to be around 7%. So, and I think that's probably an underestimation, but that's my personal opinion.
Yeah.
But so this is not like a rare occurrence, is basically what I'm getting at. You know, a fair number of people experience this. So we have two kind of sides. We have peripheral vestibular disorders, and that's where there's something that's gone awry with the inner ear itself, or central vestibular disorders, which would be brain and spinal cord, or you can have both, and many people have both. So peripheral vestibular disorders would be ones like Meniere's disease, benign paroxysmal positional vertigo, BPPV. That one's the most common. Vestibular neuritis or labyrinthitis, where a viral infection essentially attacks your vestibular nerve or the bony labyrinth. And then, I mean, a head injury could damage the inner ear, superior canal dehiscence syndrome, like the one that I mentioned, which is one of the more rare ones. So those are sort of the peripheral, like inner ear based ones. And the central ones are things like vestibular migraine, triple PD, also called 3PD, persistent postural perceptual dizziness. That one is secondary to another either vestibular event or anxiety. And that one's really where negative plasticity kind of takes over. And risk factors for that are like anxiety, negative illness narrative, so the way that you talk to yourself about the illness, body vigilance. And it's almost like your brain starts to rewire itself into a sensory processing disorder, where you become very sensitive to everything, sensitive to movement. And we can talk more about like central sensitization and how that plays a role. So vestibular migraine, triple PD, some other ones are mal de debarquement. That's another more rare one. That one, to get that diagnosis, you'd have to be in motion first, say on a boat, and then you get off the boat and you kind of feel like you've never left the boat, like you continue to have that rocking sensation. And then there's other ones like damage, or I guess damage would be the term, secondary to autoimmunity. So there are a bunch of them, but that's kind of like the way to break them down, peripheral versus central. But again, there's a lot of comorbidities between the two.
And the herpes virus can get into the ear on the vestibular nerve.
Okay. So that would be maybe a cause of vestibular neuritis.
Yeah. And I've seen people do antivirals for that and it go away. Like they will get like a sore on the vestibular nerve. So if someone is experiencing this and they don't know what it is and they don't know, all the things you just named, and they're like, okay, I can identify with that. I can identify with that. How do they get a diagnosis of any of these?
That is the $1 million question. So the problem with all of this is that as of now, vestibular disorders are not covered really in any depth in medical school. And then even for like specialists like ENTs or neurologists, they don't cover this in much depth either. And so it's finding the physician who's like fellowship trained, so done residency and then a specialized training in vestibular disorders. So typically you want to look for someone who is either a vestibular neurologist, also known as an otoneurologist, or an ENT, ear, nose, and throat, that specializes in the ear. So that would be an otologist or a neurotologist. And I'm like, can't sugarcoat it. It can be really hard, especially with geographic restrictions. They're really, I don't know, like maybe more than a handful, maybe like 10, 15, 20 of these types of specialists in the country. And so it's hard. And then people want to get in to see these people to find out, what's going on, what's my diagnosis. And then they're waiting 6+ months.
Yeah.
And so it's a major barrier for sure.
Yeah. When I was in college, I was getting a lot of issues like this. And I was like, what is wrong? What is going on? This was before I knew I had histamine issues and mast cell activation syndrome. And I went to what was the vestibular neurologist. I eventually went to one of them to have like a scan to make sure there was nothing in there. But the first ENT, I think it was, told me I had Meniere's and put me on a diuretic. And then I had a whole nother list of issues from being on a diuretic when I shouldn't have been. Yes. And just, you get diagnosed with all this stuff that's not even really happening.
Right.
So
the misdiagnosis.
It is frustrating.
The misdiagnosis rate is huge. I see people who actually have vestibular migraine diagnosed with Meniere's all the time.
Yeah.
Or the favorite, most common is it's just anxiety and like go on an antidepressant and like that's that.
It gives you anxiety. It definitely makes you anxious when you feel that way. I mean, I was very anxious when I had it because I didn't know what it was. And I was, of course I thought the worst. I'm like, it has to be my brain. I must have a tumor. Like it was really scary. And I was getting scans and nothing was coming up and no one had any answers. And it was one of the things that led me into figuring out that I had mast cell activation syndrome and had this issue with breaking down histamine in my body. And once I figured that out, then I started to feel better. So it was like the only thing that ever helped me with that. So So do you see, when you talk to people a lot, do you kind of say, you might have an issue with histamine?
Yes. So when I first work with people, I do like a biopsychosocial assessment to try to get a sense of everything they've tried, what's going on from a medical perspective, from a mental health perspective, and try to pick out like where are the holes in their treatment, essentially, because this type of illness, this type of condition requires a multidisciplinary approach. We're talking pharmaceuticals a lot of the time, functional kind of histamine, mast cell stuff, supports, vestibular rehab therapy with a physical therapist, mental health supports, dietary changes. Like it's really a full kind of lifestyle. It requires a full lifestyle change. So yes, and I can identify with the whole histamine mast cell activation. And I talk about that with people too and share my personal story of how that's definitely changed my life in terms of how I conceptualize what's going on in my body.
Yeah, for sure. So for those of you who don't know, I mean, I think everyone who listens to this knows, but with histamine intolerance, histamine dilates our blood vessels and, it has some different jobs in the body. It assists with the immune system. But when you can't break down the histamine that you're releasing in response to something, then you're stuck with extra histamine in the body. And that can cause a slew of symptoms. And it can make you inflamed in the sinuses, and then you can have more mucus release in the sinuses and the eustachian tubes, which are in your ear, and that can make you really dizzy. I mean, all these things kind of go together. That's why people say that, vertigo, they call it vertigo, which I think that's a term that some people use when it's maybe something else too. But dizziness in general is a very big symptom of histamine intolerance. So these things can really go together. So, starting on a low histamine diet can really reduce that load, at least of the histamine you're taking in. And then going further and going into, okay, well, why don't you have the histamine intolerance? Do you have an issue with your gut? Do you have an issue with your hormones? Have you been exposed to environmental toxins like mold? Like, what are all these reasons why our mast cells are releasing, excess inflammatory chemicals like histamine, and why can't we break them down? So that's a very big key in this. But what else, what else do people do for this?
In terms of treatment?
Yeah.
So I think that the first and foremost, it's about getting the right diagnosis. So like you mentioned, you were put on diuretics unnecessarily. So if it were, say, vestibular migraine, since that's a really kind of common one, it might be like migraine prophylactic medications, and then having rescue medications also.
Yeah.
It might be, again, vestibular rehab therapy to try to kind of rehabituate your brain to engage that positive plasticity. Many people try a diet called Heal Your Headache diet. I'm not sure if you've heard of that one.
Oh.
It was written by, I believe it was a neurologist from Johns Hopkins. It's low tyramine, low-ish histamine. I personally tried it, and I was able to identify that the histamine foods that were the ones that were causing me issues, and kind of like transition into a more low histamine diet, which has been hugely impactful for me. I'm trying to think of what else. Like, some people might use neuromodulation devices, like gamma core is a vagus nerve stimulator. Cephaly is a trigeminal nerve stimulator. There's some pretty off-label medications that are used. Like, some people will use beta blocker eye drops as prophylactic and rescue meds. A lot of people use benzodiazepines as rescues, antihistamines, because again, there's like the anxiety component too.
For sure.
But then the behavioral piece is so important, because the nervous system, which we talked about, that sympathetic arousal, but then also the limbic system too, because we develop these beliefs about our body and the mistrust in our body, and what, like you said, the anticipatory anxiety of like, when is this going to happen again, and am I going to be stuck somewhere, and what does my life look like, and am I going to be able to be the parent I want, and etc. Like, you can go down a rabbit hole very quickly when you're living with these symptoms. And so trying to attack from that perspective too, exercise, and all the, I wanted to mention before, all the things we know that are anti-inflammatory are super important, because when I was trying to put these pieces together for myself, I started to do some literature reviews, and I was like, okay, there's some pilot studies, newer data, but nearly all the vestibular disorders that I looked at, there was data to show that these people have chronic systemic inflammation.
Yeah.
And so I'm looking at that and thinking like, okay, there's these migraine drugs being rolled out, like for CGRP and all these things. But in my head, I'm like, why is everyone so inflamed? And why can't we address that part of it rather than kind of the downstream effect of trying to deal with it later? Like, why is everyone experiencing this chronic inflammation? And so that's kind of the approach that I take with myself, and I try to educate other people about it too.
Yeah. And it's the food, it's the environment, it's the things we're putting on our body, it's stress.
Stress is a huge one. Yes.
Yeah, it really is. So is that kind of your approach when on your end? I know that it probably takes a few different types of practitioners, right? But
Mm-hmm.
for on your end, so when someone comes to you, what are you working on the most with them?
So initially, again, I would do kind of that full assessment and make sure they have the right type of physician on board. So make
Mhm.
sure they're getting the right diagnosis. We've ruled out the scary things, the brain tumors and the
Yeah.
things we tell ourselves we have. So like MRIs and CTs, those can be an important piece of the puzzle because we want to kind of make sure that everything's okay from that perspective. Make sure they have a good physical therapist on board. Make sure I try to help them find functional medicine doctors, which can be hard to find people who are really well versed in the histamine issue. So I'm so grateful for what you do and kind of the advocacy and education you provide in that realm. Some people work with dietitians. Massage can be really important. Some people like acupuncture or
Yeah.
chiropractic. And then from there, in terms of what I work on kind of session to session, I like to work on first sympathetic arousal, kind of trying to dampen that with things like breathing exercises and mindfulness meditation, progressive muscle relaxation. Biofeedback's a big one that I've been getting into
Yeah.
lately that I love, and I've been having a lot of success with it myself. I started incorporating binaural beats, which I know that in the functional world, people really like that too. And I've also
Yeah.
started using those and loving that. And then from the limbic perspective, I would say I'm pretty eclectic. So a lot of cognitive behavioral therapy techniques, a lot of acceptance and commitment therapy techniques, which is acceptance and commitment therapy is a mindfulness based therapy. And it's really
Mhm.
about changing our relationship with our thoughts, changing our relationship with our bodily sensations to try to get us out of that constant fight or flight. But again, that anticipatory anxiety, that kind of doom and gloom thinking, because we know that the way we think has this trickle down effect in the
Yeah.
way that our cortisol and adrenaline are released and ultimately inflammation, right? So I try to look at it like from a really kind of big picture perspective and come at it from as many angles as I can because these disorders have similarities. And I think inflammation is a big underlying one. But of course, if we're talking about root cause, everyone's an individual. And so some people respond really well to dietary changes, some people don't. Some people respond really
Yeah.
well to medication, some people don't. But one other theme I see in this population too is extraordinarily sensitive to, so it can be really hard to onboard meds, supplements, food, lights, sounds, like the
Yeah.
whole thing.
They have to microdose
Mm-hmm.
supplements and even meds a lot of the time.
Yes. Yes. And
And
I
the
would,
limbic work too, right? Because that can help people to get past the fear of taking those things too, because
mm-hmm.
that can be very ingrained in you having bad experiences, that fear
Mm-hmm.
of it happening again. And that's what we see a lot in practice. We work
Mm-hmm.
with so many really sensitive people. And we have them do like limbic retraining and all that before we even think of giving them any type of supplement or anything like
Mm-hmm.
that. Yeah.
Mm-hmm. Yeah. And I think that some of the kind of vestibular specialist physicians are catching on to the level of sensitivity. And so I'm finding more people are microdosing, which is
Mm-hmm.
great. But then there's also a lot of misconception about what microdosing means. And so, like, one of the most common meds that's used for vestibular migraine and triple PD is Effexor.
Mm-hmm.
And so people will prescribe the lowest amount that the general pharmacy makes, which is 37.5. And I've had multiple people be like, oh, I'm microdosing at 37.5 milligrams. And they end up in the hospital with these
Yeah.
like crazy reactions. And so it's really realizing really just how sensitive people can be. And I'm one of those very sensitive people. So it
Yeah,
can be
I
hard to
was too.
manage.
Yeah, I couldn't take anything. At one point, I couldn't eat anything, take anything.
Mm-hmm.
So speaking of something like Effexor, how does that work on helping with this?
Mm-hmm. So typically people with vestibular disorders are taking Effexor at pretty low doses.
Mm-hmm.
So the kind of therapeutic dose from a psychiatry perspective is 75 milligrams. At lower doses, it works more on serotonin than it does on norepinephrine. And just to back up, Effexor is an SNRI for people in case they didn't know. So it can help with kind of the anxiety piece of it, but serotonin itself is implicated in the vestibular system. And Effexor is thought to have some migraine prophylactic properties. And many people present with that comorbidity, vestibular migraine and triple PD. So kind of the migraine attacks, but then in between the attacks, they feel dizzy all the time.
Yeah.
So the attacks would be kind of the migraine, the dizzy all the time in between typically is more of like a triple PD picture. So it's just, I just use that kind of for example's sake, but that's one of the most common medications that I see prescribed.
Yeah. What people don't understand is that a migraine is actually not just the headache. It can be the dizziness. It can be the other symptoms. You can have other symptoms and have a migraine, and the pain can just be one symptom of a migraine.
Right. And it's actually, I think the stat is something like 50% of people with vestibular migraine don't have head pain. So I'm one of those people. And so they'll go to a neurologist and they'll be told you can't have a migraine disorder because you don't have pain, which is not true. And so then they end up again, like, I don't know what this is, and I must be crazy, or I must have a brain tumor or whatever. So it's really about building kind of education and awareness around it.
So if someone's listening to this and they're like, okay, what do I do? Where do I start? How would you walk them through what to do?
This is a great question. I think, again, getting the right diagnosis can be important, but it doesn't have to be necessarily the first step because, again, you could be waiting 6+ months to get in to see a specialist. So I think a few things. I think getting a psychologist or mental health provider on board to just be a support for you to help dampen that sympathetic arousal, to provide some education maybe about what's going on, to teach you how to manage this stress just while you're trying to get through this period is hugely important. You could see a physical therapist and they can do more kind of functional testing to see what deficits you might have in terms of the vestibular system, and they can prescribe certain exercises.
It can be really good, actually. That was one of the things I did too. I started doing exercises from a vestibular therapy. What do they call? What is their...
So it's just a physical therapist who specializes in vestibular disorders, but that therapy is called VRT, or vestibular rehabilitation therapy.
Okay. Yeah. And they can be very helpful.
Yes. And so that can be a good place to start too. And then I think diet can be another really good place to start. And a lot more conventional doctors are prescribing, again, that heal your headache diet that I was telling you about. But the problem with it is I find that patients are saying, here, try this, and then they don't get follow-up about it. And so the elimination diets, I've seen kind of the trickle-down effect of it causing a ton of food anxiety and like, I can't eat all these foods, and which people for sure have food triggers. They for sure might have histamine intolerance. But I think it's about finding the right guidance around diet. So I don't know if you can speak to that at all, but I've worked with many people who get to a place where they've created so much anxiety, like it's almost become disordered eating. So have you seen that in your practice?
We have to really be careful with being able to identify that in somebody before we go ahead and tell them what to do for diet. So we talk to them a lot, about that. And that's why with my book, my first book, the 4-Phase Histamine Reset Plan, I have a yes, no, maybe list. A lot of the foods on the maybe list can be an issue for histamine, but they're not the biggest triggers. So I have people start by removing the no foods. And I'm like, look at the yes foods, like eat as many of those foods as you like. Think about what you can have, try the maybe foods, and just eliminate the no foods. And then we follow up with them, in 2 weeks. And we're like, okay, now we have them write everything down. and not forever, because that can also lead to disordered eating, but we want to do that clinically, and so we see, okay, so this is what you ate in a day, and at 2 o'clock you felt dizzy or you got a headache or whatever. So let's see why. And we just see if we can see a pattern and all that stuff. So some people, we really tiptoe into it. And some people they don't have an issue at all with dieting. They're very easy to do that with. So it really just depends on the person. But I think that at any level, you can do something to help reduce that histamine load. And we're doing this while we're waiting to figure out, with the testing that we've done, why they have an issue with histamine in the first place. So that's our approach, and it works really well. And so many people with just the diet alone see a big change for sure.
For sure. And I was one of those people, and low carb also helped me a lot in the beginning because I didn't realize like how dysregulated my blood sugar was.
Yes. Yeah.
One question I get people messaging me all the time that maybe you can cover is, if someone were to come to you with vestibular issues, people ask, how do I know if I have histamine intolerance or mast cell? Like, and they want to know what blood tests they can use. And I like try to explain, like, there aren't necessarily great ones. So I think it would be helpful for you to talk a little bit about that, because people ask me that probably daily.
Yeah. So we just have you test it with the food, because it's the cheapest way to do it. It's the most accurate, in my opinion. It's really easy to get a reaction from eating a high histamine food if you have an issue with histamine. So it's pretty reliable. I mean, they come out with tests, and testing histamine in the blood is not about that. It's about methylation. So that isn't how you do this. And some people be like, oh, I have a lot of histamine in my blood, or I don't, so I don't have a lot of histamine in my blood. So that means I can't have an issue with histamine. I'm like, that's not what that's saying. So anyway, so what we say is eat like fermented foods, soured foods, aged foods for, it could take you a day to figure it out. It could take you a week, but eat those for a few days. If you get an increase in your symptoms or new symptoms, especially if you're dizzy and you get your dizziness is really exacerbated, then stop eating those foods and do like just the foods on the yes list and see what happens. And 9 times out of 10, their symptoms will die down very much. And then they go, okay, I can identify that this is definitely a trigger. Now, it's not the only issue, because we know with histamine intolerance, there's always a driver. But it's a really good place to start, and it's a really good tool to use to help manage that while you're digging deeper and finding out why you have it in the first place.
And I really like to work with people on the acceptance piece. And when I say acceptance, I don't mean you're going to feel this way forever or you're going to be on this diet forever. But people get so in their heads about, what does this mean? Am I ever going to be able to eat anything again? What does this look for symptoms? And so working on accepting just what's going on in the present moment while you're taking these baby steps to, listen to your functional doctor or the physical therapist or a psychologist or whatever, that alone can be really almost freeing for people, because they feel super trapped.
Yeah, it is. That's why what you do is so important, because people really need to understand those things, and they really need support in that way. And, with just doing a diet, or that they saw online or whatever, they aren't getting that support, all the time. And especially when it comes to these things, if you don't look sick, you're not going to get a lot of support from people around you, unfortunately. Right. And we see that all the time. And it's so sad. People say, no one believes me because I look fine. No doctor believes me. My spouse doesn't believe me. My friends don't believe me. So they don't have a good support system, and it's really hard. So
it is. I've had countless people say to me, I would rather have a cancer diagnosis.
Right.
Because support, like, we're social beings. We need support. And so when we're dealing with these debilitating symptoms on top of trying to convince people that we're experiencing these symptoms, it just compounds the suffering and it makes it so much harder. So I'm so like thankful for providers like you. It feels so refreshing, honestly, to talk to you because it feels like you get it. And you've been there, you've experienced it. And it sounds like you're doing really well now. And I know that people also really like to hear kind of stories of hope and success stories and realize like there can be a light at the end of the tunnel.
Yeah, I think that's why I talk about it so much. Like I used to talk about thyroid and blood sugar and, just gut health, hormone health, like functional medicine in general. And when I started talking about histamine, it was such a big response. And I was like, sometimes I don't want to talk about histamine, sometimes I want to talk about something else because there's a lot of things I do and there's a lot of things I work with people on, but I do see that histamine is something that's really important to talk about because there's a lot of people that aren't, and a lot of people that know they're suffering, but don't know what it is. And the education needs to not only happen for them, but for their family members.
Exactly.
And I can tell you, I've talked to, plenty of spouses and I can show them, I can show them stuff on testing and, show them what's going on with different things and, explain to them this isn't, nobody would choose to make this up in their head.
Right.
At all.
Right. Exactly.
But unfortunately, people really think that that's what they're doing. It's weird to me. But it's true. So yeah. Well, so are there any other natural ways, that you could, for anyone listening, that they can, so diet, getting support with someone like you, maybe working with a physical therapist, definitely calming down the nervous system and, getting that diagnosis ultimately, but really it's all these other things that seems to be the most effective.
Yeah. So in terms of like supplements, it's funny because the supplements that have been studied for migraine that are prescribed by, I would say, most conventional doctors at this point are magnesium, CoQ10, and riboflavin, none of which helped me. And I think like looking back, I feel like those things were probably just a drop in the bucket for like everything else that was going on behind the scenes for me. But those are kind of the biggest that you'll hear about talked about in the migraine community. I personally have found the biggest help from the more histamine, mast cell stabilizing type supplements. Like ginger has been hugely helpful for me. And then
ginger is so anti-inflammatory and antihistamine for those listening that don't know that. It's really, and you can find it in supplements. You can do ginger shots if you're brave.
Yeah, I started looking into it when I saw a study that showed that it performed as well as Claritin for seasonal allergies. And I was like, I got to get on that.
Yeah, because it's not going to reduce the DAO enzyme that breaks histamine down the way that antihistamines can long term. So, and then, we're just saying you got to do what you got to do, obviously. But if there's more natural ways like ginger and quercetin, maybe, or even, perilla seed extract, like different things you can do, resveratrol, certain anti-inflammatory. What about like boswellia or curcumin? Did any of those work for you? Or
yes, I personally haven't done well tolerating the kind of the more heavy hitting mast cell stabilizing type, like quercetin and resveratrol, the ones that you're listing. I'm hoping
you may have an issue with your COMT gene. Do you know if you do?
I have not been tested for that, but I have looked into that a little bit.
Yeah. We see that in practice. So it's on the Dutch test. It shows you the activity of that gene. So if it's slow, we try not to give people quercetin if that activity of the gene is slow.
Interesting.
Because it can slow it even more. So
got it. And I was just trying to think of other natural things. Sleep is hugely important. And so like circadian rhythm type regulation, like getting morning sunlight, can be really important. And there is some research that shows that vestibular disorders can lead to insomnia, and then insomnia makes the dizziness and anxiety worse. So then it's like becomes that cycle again.
Yeah.
So some supports around sleep, like getting exercise at the right times, not having caffeine too late in the day, although caffeine is a trigger for a lot of people, and a lot of people just avoid it altogether. And same with
Yeah.
alcohol. Um, and I mean, melatonin can be helpful for some people, relaxation exercises before bed. I personally love binaural beats like delta waves before bed.
Mhm.
So sleep is hugely important. I also screen everyone for sleep apnea because that hypoxia, like the kind of lack of oxygen during the night, can actually damage the inner ear. So we want to be really sensitive to that too. I'm trying to think of any other kind of natural treatments. I know we talked a little bit about this, but just the social support and how important that is, and feeling like you have a community. And I'm sure you've seen, especially with mold and Lyme and all these things, there can be support groups online that are actually quite anxiety provoking for
Oh
people.
my gosh. Especially I've noticed with the Lyme community, the Facebook groups and stuff,
Mm-hmm.
I feel like it's focusing a lot on, let's say you're feeling good today and you go in and read a post about how horrible someone's feeling. It's not that it's wrong for anyone to post that. I just think you should be aware of how those things make you feel to read them,
Mm-hmm.
and note that if you felt good before you read it and then you start to not feel well, maybe that type of information isn't good for you,
Mm-hmm.
you know?
Yeah. So that, and even just from like, if we're talking about a neuroplasticity perspective, where we put our attention is really important. So when we're Googling all day and we're in these groups all day, it's telling our brains like this dizziness is super important and I should make those pathways even stronger, rather than focusing on like the things that bring us joy and the steadiness and all those things. So it's complicated. It takes a lot of repetition, but I just kind of want to instill hope in people that you can make leaps and bounds and not feel dizzy all the time. And there's so many different options for things that you can try.
Yeah. Well, for those listening that are, kind of resonating with this, I think that, starting with diet, trying to reduce inflammation is huge.
Mm-hmm.
Maybe working with a functional medicine practitioner to kind of dig in and do some testing, working with somebody like you to hand manage the emotional aspect and the nervous
Mm-hmm.
system and all of that stuff is really, really important.
Mm-hmm.
Working with a physical therapist, and then, maybe someone else like a neurologist,
Do
can be
you
really helpful.
do you have any tips? Because I get asked this daily too, of how to find the right type of functional medicine doctor. That's probably a really hard question
I
to
would
answer.
say a lot of us are virtual. So I see people all over the world. I have patients in Australia. I mean, I have UK, everywhere.
Mm-hmm.
So there aren't a lot of people. What people say a lot is that they don't have anyone by them, like in
Mm-hmm.
their area. But there's so many people online now. So what I would recommend is that look at everything that they have and see if they really know what they're talking about,
Mm-hmm.
because a lot of people are specialists in functional medicine these days that may not even have training. So you just need to be careful. You need to make sure they've been working with people. They've worked with a lot of people. They know what they're doing. A lot of the times it's good if they've had something themselves,
Mm-hmm.
because they really can sympathize with how you feel and they really understand what you're going through. But online, I think, go on Instagram and hashtag functional medicine. You'll see a lot of people using that, or I don't know.
Mm-hmm.
I don't know.
Yeah, I think I just asked because kind of in my journey, I felt like it took me a while to find the right functional provider
Yeah.
that focused on the histamine issues, because a lot of them don't.
Mm-hmm.
So I didn't know if there was like I don't know, something specific to look for, but it seems like you just have to kind of wade through what
You
they talk
do.
about and if they have content and kind of what they're talking about.
And if they're going to look for the why, That's the real purpose of functional medicine, finding out why. Everything. Put any symptom or syndrome or anything in there, you want to know why. And the only way to know that is to do testing.
Yeah.
So that's the most important. And not everybody can afford testing. So yes, we do offer other things like books and programs and stuff to help you get as far as we can without doing testing. But if you can afford testing, you definitely want to work with someone who's going to look for the root of your issue and then give you a protocol based on what they find in the testing, not just give you a bunch of supplements out of the gate based on what you're telling them, because it might not, so many things overlap, so you don't always want to just take a bunch of stuff because it's symptom-based products.
Right. Yeah, that makes total sense.
Yeah.
Yeah.
Well, thank you so much for coming on and kind of spreading awareness to what this is. And especially post-COVID, we're seeing so many people with
that is, I didn't even think to talk about that, but I've seen so many people diagnosed with vestibular migraine, triple PD, vestibular neuritis, even post-COVID, but also post-vaccine.
Oh yeah.
And so I think, again, the awareness piece is really important. And we know that like with long COVID, there's more talk about the mast cell involvement in that. So it's getting a lot more attention, which is, obviously long COVID is not good, but getting more awareness around the mast cell relationship is really important.
My practice is about 50% post-COVID or post-vaccine right now.
Oh, wow. That's massive.
That had no histamine issues that they knew of before. And now they're having all these symptoms and they have no idea why. And it's crazy. How many people we see with that. And sometimes I'll find that they did have an issue and they just didn't realize. And it was really more triggered by having COVID or getting vaccine, having a poor reaction to it. But yeah, we're working with so many people that is their story. And it's hard because they felt so good before and, so.
Yeah.
Well, thank you so much for coming on. So where can people find you?
Yeah, so I'm most active on Instagram at Rooted Behavioral Education. That's kind of where I provide the educational content. And then I do have a private practice that's at the Vestibular Psychologist where I work one-on-one with people, but I'm only licensed in certain US states. So that's a bit more limited. Whereas the education piece, I have some courses and I post content and do questions every week and everything. So I'm happy to welcome anyone to the community. And I love talking about this stuff. It's so important. And I love kind of providing hope that, recovery, improvement, all of these things are really possible.
Yeah, they really are. You just have to have the right guidance and they really are. So, well, thanks again. We hope that you enjoyed the show, everybody. Thank you guys so much for listening to this episode. And if you love this episode, please leave a review. It only takes a couple minutes. And you can find out more about us on DrBeckyCampbell.com. And you can follow us over at Instagram on @HealthBabesPodcast, @Dr. Becky Campbell, and @Dr. Krystal Hohn. Have an amazing day.